case of a 42-year-old male who came into the office with right shoulder, neck, and arm pain. This has been going on for 3 months. He was in very severe condition. He rated it as anywhere between a 9 to a 10 out of 10 on the pain scale, 10 being the most severe. Sharp, numb, and throbbing, going down his right arm. Very, very severe condition. Now, anytime I do an exam, if I find nerve pressure going to different parts of the body, I will ask questions about that. And here are some of the other things that I found out. Past history of sciatica, he said his stomach felt different. Shortness of breath, that could have been due to the pain. Hives, and he had headaches more than normal. So his condition was very, very severe, and this full spine X-ray really shows you this right here. In this X-ray, he's very, very kyphotic, and you can see how that continues right through the neck. Now, about a month before the patient came into the office, he has an imaging report from a local imaging center here, and here were the findings on it. Disc space between C5 and 6 is slightly narrowed, and the impression has non-specific straightening of the spine, which can be associated with muscle spasm. Now, those images were just done on the cervical spine, and without the other information of what's going on below, all the way from the pelvis all the way through the lumbars and thoracic spine, we have no idea how one area of the body is affecting the other. Generally, in these conditions, when the neck is so severe, it's not the cause of the problem, it's compensating. So we took a post X-ray, and I want to show you the difference between these two. This is 11 visits in between. These are the before and after X-rays. What we did was we located where the subluxation was and began to correct the spine. Now, these X-rays are taken 11 visits apart. However, he was much more upright before that, but it took us a little bit of time for his body to start putting posturally how it should normally be. So I want to run through this with you. Now, one thing I want to note here is we always see how the body is adapting based on where the plumb line's at. And the plumb line is drawn straight up from the center of L5. And ideally, we would like to see that going between C7 and C2 with a normal anterior curve. So we measure certain points along there to compare how the before and after X-ray check out. Now, in the thoracic spine, we're using the inferior anterior body of T7. That's 90 millimeters behind that plumb line, where here it is 76 millimeters behind that plumb line. So there's a 14 millimeter change where you'd say loss of kyphosis on this second picture. Let me show you what's going on up in the neck. So in the neck, what we measured was C2, the dens in C2. And from the plumb line, the dens is 28 millimeters in front of the plumb line on the pre-X-ray. On a post-X-ray, it's still in front of it, but it's lost 10 millimeters. Now it's only in front, 18 millimeters. Much more normal looking spine here on the second X-ray. You can see plumb line L5 touching the body, the anterior body of C7, and almost touching C2, and starting to develop a normal anterior curve. A huge change in this guy's life. When he brought in X-rays from the imaging center, just the sectional X-rays of the neck, it was very clear, and it was noted in the radiology report, there was muscle spasm going on. However, it's very important to understand muscles don't just spasm. The only way a muscle can contract is by a nerve impulse going into that muscle. The reason the body is put into an antalgic posture by the body is because there is so much nerve pressure at some area in the spine, some subluxation in the spine, that the only way the body can adapt and still function is by causing this abnormal muscle contraction, a spasm, to at least try to let the body survive. Once we can get rid of that nerve pressure and correct that subluxation, the body comes back to a much more normal posture. Understand, posture is a nervous system thing. It is not a it's not a conscious thing. You can't consciously control your posture. Trust me, he would have much rather been able to stand up straight when he came into the office. But he couldn't. His body was putting him in that position. However, when we take the post-X-ray and we can correct the subluxation, at least the beginning stages of correcting the subluxation, now we can see he's in a much more abnormal, much more upright posture without doing any exercises, without doing any muscle work. This is a chiropractic condition. It does not mean muscle work is not necessary. because if this would continue to go on, yes, there's an absolute possibility that this guy can start developing adhesions and other things like that that can really start to damage a muscle fiber. And they need to be worked out by a competent therapist. But as far as getting him corrected, the first thing we needed to do was get the pressure off that nerve, allow the body to start functioning much more properly. I hope you found this video educational.